On a Sunday afternoon, fear gripped a CityMD clinic in Manhattan. Two patients walked in, visibly unwell. Their symptoms sparked immediate concern. Fever, vomiting, and diarrhea. These were red flags. Making matters worse, the patients had recently returned from Uganda. Uganda. The name alone was enough to conjure images of the deadly Ebola virus. First responders, fearing the worst, rushed to the scene. The clinic on East 125th Street and Lexington Avenue became ground zero. The patient's symptoms and travel history pointed towards a potential Ebola outbreak. The situation was tense, mirroring the early days of the devastating 2014 Ebola epidemic in West Africa. The symptoms exhibited by the patients were indeed alarming. High fever, vomiting, diarrhea. These are classic signs of Ebola virus disease. Muscle pain and weakness can also occur. In severe cases, Ebola can cause internal and external bleeding. This is why healthcare workers were quick to react, knowing the potential consequences of inaction. The fact that the patients had recently traveled from Uganda amplified the concern. Uganda, like many Central African countries, has experienced Ebola outbreaks in the past. The possibility of the virus reaching New York City, a densely populated metropolis, was a frightening thought. Initially, first responders took no chances. Donning full hazmat suits, they carefully transported the patients to Bellevue Hospital. Bellevue, with its specialized isolation units, was best equipped to handle potential Ebola cases. The CityMD clinic was temporarily shut down as a precaution. However, as more information came to light, the situation took an unexpected turn. The patient's family members, who had been in close contact, also fell ill. The rapid spread of the illness among the family suggested a different culprit, norovirus. Norovirus, highly contagious, is known to spread quickly through close contact. While both Ebola and norovirus share some symptoms, they are vastly different diseases. Ebola, a viral hemorrhagic fever, is spread through direct contact with the bodily fluids of an infected person or contaminated materials. It is a serious illness with a high fatality rate if left untreated. Norovirus, on the other hand, is a common stomach bug. It spreads easily through contaminated food, water, surfaces, or direct contact with an infected person. While it can cause unpleasant symptoms like vomiting and diarrhea, it is typically less severe than Ebola and rarely fatal. The swift response to the CityMD incident, though initially geared towards Ebola, underscores the importance of public health protocols.